Endometrial risk factors. The name itself indicates the risk factors. Endomet. E for elderly, N for nulliparity, D for diabetes, O for obesity, M for menstrual irregularities, E for estrogen therapy, and T for tension, that is hypertension. WHO classification of tumors of uterine corpus. The epithelial tumors and precursors, mesenchymal tumors and other tumors. Coming to epithelial tumors and precursors include hyperplasia without ATPR and ATPR hyperplasia or EIN, endometrioid intraepithelial neoplasia. And endometrial carcinomas, they can be type 1, type 2 or neuroendocrine tumors. And the neuroendocrine tumors can be low grade and high grade. Low grade neuroendocrine tumors are called carcinoid tumors. And high grade neuroendocrine carcinomas include small cell neuroendocrine carcinomas and large cell neuroendocrine carcinomas. Now coming to mesenchymal tumors, benign includes leiomyomas, whereas malignant includes leiomyosarcomas. The most commonest invasive cancer of the female genital tract is carcinoma of the endometrium. It is of two types, type 1 and type 2. Endometrial carcinoma, most common type 1 endometrial carcinoma, seen in 55 to 65 years age group, and the precursor lesion is endometrial hyperplasia. And the risk factors, as I said, endomet, obesity, diabetes, hypertension, infertility, unopposed estrogen stimulation. And genetic alterations include mutations that increase the PI3K or AKT signaling pathway. Involved are P10, KRAS or ARID1A. Morphology wise, on gross, there will be a localized polypoidal mass or diffusely involving the endometrial lining. It can be well differentiated, moderately differentiated or poorly differentiated. Well differentiated, composed almost entirely of well formed glands with lack of intervening stroma. And the moderately differentiated shows well formed glands mixed with areas composed of solid sheets of cells up to 50% or less of the tumor. And in the poorly differentiated, it comprises of greater than 50% solid growth pattern. This well differentiated is considered as grade 1, moderately differentiated as grade 2 and poorly differentiated as grade 3. Metastasis, lymphatic spread involves the regional lymph nodes and the hematogenous spreads involves the lungs, liver and bone in carcinoma of the endometrium. Coming to serous endometrial carcinoma, this is the most commonest type 2 endometrial carcinoma seen in 65 to 75 years age group with risk factors endometrial atrophy and thin physique. And the precursor lesion is serous endometrial intraepithelial carcinoma. And the genetic alterations is because of the mutations in the TP53 gene. Morphology wise, there will be a large bulky masses are deeply invasive into the myometrium. And microscopically, it is poorly differentiated tumor having a papillary growth pattern composed of cells with high nucleocytoplasmic ratio and atypical mitotic figures, hyperchromasia and prominent nucleoli. And the spread is by lymphatic or transtubal. Clinically, the patients are asymptomatic or irregular or postmenopausal vaginal bleeding is there in the history. Investigations include ultrasound and biopsy. Age wise, type 1 is 55 to 65 years, type 2 is 65 to 75 years. Predisposing conditions include unopposed estrogen stimulation, obesity, hypertension, infertility, diabetes. Whereas for type 2, it is atrophy of the endometrium and thin physique. Precursor lesion for endometrioid is atypical endometrial hyperplasia. Whereas for serous carcinoma, it is serous endometrial intraepithelial carcinoma. And the molecular features includes mutations or inactivation of P10 and microsatellite instability and TP53. Whereas for serous carcinomas, it is mutation in TP53 and germline BRCA1 or BRCA2 mutations. Microscopically, in endometrial carcinomas, there will be ranging from well to poorly differentiated, grade 1 to grade 3. Whereas in serous carcinomas, they can be serous, clear cell or mixed Mullerian tumors. Of type 1 is because of the lymphatics, whereas type 2 is intraperitoneal and also through lymphatics. Behavior of type 1 is indolent, whereas type 2 is very aggressive. Carcinoma of endometrium, gross and microscopically. See, there is a diffuse tumor involving the endometrial surface, and the gross appearance is diffuse and polypoid.